Dr. This, I want to ask, in case of a local advanced rectal cancer with limited involvement of posterior vaginal wall implant, what procedure you prefer?
The vagina is a very forgiving organ in terms of being able to reconstruct it. It's fairly straightforward to do that, particularly if the volume of tissue is relatively small. You're usually, in my experience, better off, if the patient is okay with it, having a hysterectomy with that so you can get good access, and then removing the top of the vagina, because its ability, its capacitance will grow that way much better than if you get luminal narrowing this way. In our early days, we used to try to do, using a VRAM, a vertical rectus abdominal muscle, we would try to decellularize the surface of it, just take the surface skin cells off, and to create a neo-vagina. But that's a classic example of why men should never operate on women without asking them, what do you want? Because actually, by the end of it, they'd say, I don't feel any more whole because I have a neo-vagina, and I'm never using it, ever. I don't want that. It's a very masculine concept to think of sex as something which needs to be penetrative rather than anything else. So these are all of the things that we're learning from this as we go along. And like all societies, we have precious few females. We have maybe 20% females in the Pelvics Collaborative, and we need more girls precisely to stop us doing stupid things like this. Because when you ask men about their sexuality, it's very easy to understand what it is that they do. It's binary, isn't it? There's point and shoot. But when you ask about the complexity of sexuality in females and what's good and what's not good, most of the time they're quite straightforward and quite honest about it and say, that does not matter to me. Cure me, then we'll worry about the sexuality later. So fascinating. The difference between what we think is important as doctors and what they think is important as patients is often vastly different. Yeah.
Okay, thanks, Des.
Thank you.
Thank you very much. Appreciate it.